can have my little certificates in the back.
Hey, it's Dr. Hillary, Rangeline Chiropractic. I'm here with my friend Lanessa. Say hey.
Hi.
She is going to talk to us about proper foot care. So, in my mind, proper foot care to me means like there are heels and our toes and our toenails as far as pedicures, doing them on their own. Lanessa, tell us about yourself and where you did your training.
Oh, okay. So, again, as Miss Hillary said, I'm Lanessa Hubbard. I am the owner and nail tech at Certified Nails. This is a little bit different when you talk about where I did my training because nail school was part of my high school education.
Okay.
Um, for me, this is a second career because I used to previously be a chemist. So for me, this is a second career. But I decided to use this, so my training is a bit different. But when it comes to training in a nail salon, I'm actually a certified master pedicures, which means I hold training in advanced foot care. One of my trainings that I'm currently doing right now is oncology training, so that way I can have people with compromised immune system, people going through cancer, or things of that nature. I can better give them foot care for their needs.
Mm-hmm. What about, I know you and I always chat about this because I actually go to you. You do like a special training or technique with like problem toenails. I forget the name of it. But
So
you,
restorative pedicure.
yeah, but didn't you have like some special training with that too? I forget. You mentioned it. I
That was
totally
a
listen. I totally pay attention to everything you tell me, just so you know.
Good to know. Good to know. That's the certified master pedicurist. That
Okay.
training is where I got the advanced foot care training.
Yes.
Yes.
Awesome. So there's a lot of people who do pedicures at home and they cut their own toenails. And I know you cringe at the sound of this because I was also one of those people that would cut their own toenails until Lanessa told me to stop doing it. But tell us, like, why we should come to a professional like yourself versus doing things at home.
Well, the issue is like how you just stated. Cutting your own toenails, you can cause yourself to have an ingrown toenail and not even know it. A lot of people they don't cut their toenails straight across, and then they miss parts of the nail. So as the nail is growing out, it's digging into your skin. So that's why one of the things I would tell you is just no, just let me do it. The other thing is that with someone like myself having advanced foot care knowledge, I can see things that you won't normally see. So let's say a client had a plantar's wart, things of that nature. I could say, hey, you need to get an appointment with a podiatrist because this needs to be taken care of. I can't service you or, things of that nature. I could just direct them in the right direction. So same thing with if it's something to where a client needs to see a dermatologist, I can say, hey, you need to go see a dermatologist. So it's all about recommending and referring on things that you wouldn't normally see because not a lot of people look at the bottom of their foot and goes, oh, well, what is this? Oh, I need to get this looked at. So if you get a professional pedicure, they'll notice it and they'll see it and they'll say, okay, yeah, we need to get you into the right place to get this looked at and taken care of.
Mm-hmm. So, like your pedicures, what I tell everyone is that it's not just about the fluffiness and the color. It's about like maintaining like wellness within the feet. And I like that you refer out to podiatrists when needed. And I also think too, like sometimes patients come to me and they say like, "Oh, my toe hurts here and there," and I think, is it just an ingrown toenail? Like is it really like a structural issue or is that something that Lanessa would be better dealt with to check out?
Yeah, and when situations like that happen, like if someone comes to me, I won't go outside of a nail tech. I always refer out or I recommend because at the end of the day, I'm not gonna do anything with the ingrown. So I'm gonna say, hey, you need to go to your podiatrist because this is something it could take a small little, surgery and they can fix it with the snap of a finger. And
Mm-hmm.
that way you're not in pain anymore. So it's something that needs to be taken care of by the right professionals.
Yes. And I love that about you, that you know your boundaries and know to refer out. And I can just say by experience that I've been places before and they would want to dig into things. And I think, are you sure you should be digging in that little crease right there? Right?
Yeah, yeah. You got to make sure you keep yourself safe.
What about like common mistakes that you've seen at your salon where people, we mentioned the cutting incorrectly, but what are some other common mistakes that people do at home when they give up and they come to you and then you have to fix problems?
Well, I one of the most common things I've noticed that I've had to talk to clients about is the proper way. Like for example, a lot of clients don't. How can I get this? Sorry. um, One of the things that I see most common when people come into my salon is the fact that they might have something fungal going on in between their toes.
Hmm.
And with me, I'm not a doctor, so I normally recommend, I'll recommend something that they could use to help with that. But then I also ask some questions to dive a little bit deeper to see why that problem is occurring. And what I've noticed is, as humans, when we get in a shower, we wash the bottom of our feet. We don't go and wash in between our toes, and when we get out the shower, we don't dry in between our toes, neither. And with fungal anything, it loves moisture. So we're creating issues that can be resolved by something simple as properly washing our feet and drying in between our toes, right?
Mm-hmm.
So a lot of times when I see issues, I recommend and I refer. I don't treat, I recommend and I refer. And that's one of the biggest ones I've been seeing all summer.
Oh.
So I'll ask questions like, okay, do you have sweaty feet? Or, does your feet smell? Just to kind of get understanding of what's all going on so that I can say, okay, hey, here's some shoe deodorant. Here's some foot deodorant. Here's something for that peeling skin that you have going on so we can clear up all issues at one time versus just saying, oh, well, here's something for the in between your toes to help. And they're like, why does it keep coming back?
Mm-hmm.
So if you find out what the problem is and you help them resolve all those issues, it's better at the end because they'll say, oh my gosh, this is clearing up real good. Like, oh, thank you. But again, if it's something that I have no business dealing with, to the podiatrist or a dermatologist they go.
What about like cracked heels? Like I see that a lot in my practice, and I know that I've seen some nasty heel pictures of yours that you've sent me. But are the cracked heels, is that a big problem that you also see?
Yes, I see that quite often. And that's when my restorative pedicure come in because that is a pedicure that is for situations like that. That is actually a pedicure to where that's when my advanced foot care knowledge comes in, and it's a specialized pedicure that's going to help you with whatever your condition is going on. Like when you're saying cracked heels, I do certain things within that pedicure that's going to help get those cracked heels down, and then we'll put you on a regimen to help with it fully closing up. So that
Because
is
that
a
could
really
cause
good thing.
that would cause a lot of foot pain, I would assume the
It
cracked
does,
heels. And
especially in the
so
wintertime.
yeah, and so we're approaching that change of weather season, and I think that we're going to start to see that and people having heel pain, and I like to look at their heels and see like, well, what is it on your heel? And then a lot of times that's when I notice the cracks and stuff like that. Well, I'm going to try and share my screen because I've got this lovely picture that Lanessa gave me. And by say lovely, I feel like viewer discretion is advised on this one. Let me see if I can get this switched over for you. All right. All right, can everyone see this? Lanessa, do you see this picture?
Yes, I can see it.
Okay, so tell us about this before and after picture.
So this client is approximately, I want to say, in about her 70s. This was her first time having a pedicure. She's never actually had a pedicure before. So I went in, I did the restorative, I did some debridement, which debridement is pretty much cleaning out her sidewalls underneath her toenails. Then I did some toenail reduction. Um, and as you can see that the second toe, that's actually a pincer nail. So it's curled all the way in.
Is it? Oh, I've
Um,
never seen anything like that before.
yeah, it's a pincer toenail.
Okay.
So pretty much just cleaning it up, giving her good foot health. That was the main goal of this pedicure. And you can actually see the before and after. It pretty much doing the restorative, it provided transformational results.
Yeah,
So
that's amazing for one pedicure, to be
yeah,
honest.
yes, I was happy to do it. I mean, I was happy that she came in, and it made me feel good, and it made her feel good. So
I bet. I bet. And I noticed in a lot of, I'm going to stop sharing. I noticed in a lot of the pictures that you sent me, you don't always paint toenails. And so I think that your restorative pedicures are great for men too, or even women that don't want color. It's, a pedicure is not necessarily about just painting the toenails, right?
No, it's not. So with the restorative pedicure, polish isn't even included in that
Mhm.
price because at the end of the day, I am focused on more of the health of that, of your feet when you're getting the restorative versus making them look pretty. You can throw polish on anything and make it look pretty, right? So the
Right.
main goal of that pedicure is to help whatever issue you have going on. That's why it's a customizable pedicure because everybody's different. Not everybody have cracked heels when they come see me for a restorative. Some people have really thick calluses that they've been dealing with for a long time and just wanted to be minimized. So polish is an add-on service for that pedicure versus like one of my standard pedicures that comes with polish because I want to spend my time making sure that I address whatever issues you have going on.
Mm-hmm.
So polish is just a plus. Any one of my pedicures, even with my regular pedicure, I'm more focused on the health aspects of that pedicure versus the polish. I'll spend more time, cleaning your toenails, getting the dead skin off, things of that nature, versus just hurry up and rushing through it and then throwing a polish on and saying see you later. You
Yeah.
know, that's why my pedicures can last between 4 to 6 weeks because I'm focused more on the healthier side of the pedicure versus the aesthetics of it of just making it look pretty.
Do you have quite a diverse, like men to women, or still mostly women come to see you?
I have. It's still mostly women, but I think I got about probably 6, 7 men that come see me on a
Mhm.
regular basis. So I mean, I guess that's pretty good, right?
Yeah. Well, what I love about your salon is it's just you in there. It's super clean. And so that's one thing that I obviously look for when I'm going places. So when we're going in, let's say someone can't come to you, you're in Noblesville, you're near this, is it called the square in Noblesville?
Yes, downtown square. Yep.
So that's where you're located, and we can always add your information on here. But let's say someone's watching this from Michigan. What should they look for in a good quality salon? And or what would be some tips that you could tell us to look for when people are picking a place to go for a pedicure?
Um, well, number one for me, since we're in COVID, is going to be sanitation. Sanitation, sanitation, sanitation. You want to go to a place that is keeping you safe. You want to go to a place that is properly sterilizing or disinfecting. Disinfecting and sterilizing their implements, right? You want to see that the facilities are clean because you want to feel safe. That's the biggest thing for me. Like even with my pedicures, the chair that my clients sit in, I'm, disinfecting that chair.
Mhm.
So I make sure that everything is clean in here because we're in a time where, hey, do I really want to touch that polish bottle or not? I don't know who she had in here before me. So the biggest thing though is making sure that they're using the proper channels to, keep their place clean and keep their tools clean because it's easy to get infection from dirty tools.
Yep.
So sanitation is very, very, very important. That's the number one thing I would look for. Is I would probably scope out the place before I even book a service. I would walk in, look, see how they're doing their services and things of that nature. See how that whole business is going before you just book.
Mhm.
Super shop them if you
Yeah.
get service with them.
I mean, I feel like you could ask too, like, hey, can I see where you sterilize and disinfect everything, right? Like, is that too much to ask, do you think?
If somebody asked me that, I would be shocked, but I would be happy to show them. I'm like, hey, look, here you go, take this.
I'm
So,
totally gonna ask next time and be like, show me where we did this.
yes,
Actually, I see you doing everything when I'm there. So,
yes.
let's see.
Well, Hillary, I can say something else too. It's okay to interview your nail tech and ask them questions. I love it when my clients ask me questions. I get excited. I'm like, oh, okay, well, blah 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 blah.
Mhm.
So it's okay to interview who you want to do your services. There's nothing wrong with that.
Well, there's sensitive skin down there. I mean, I'm sure everyone listening has had a pedicure gone wrong, and once bitten, twice shy, so to speak, right? Um, I love that your pedicures are gentle because I've been hurt so many times with things jabbed in my cuticles and underneath. And I told you that right from the beginning. I'm like, I've
Yeah.
got sensitive feet and it makes me nervous. So be gentle. And you've always done a wonderful job.
Well, it's all about using the proper tools when you're providing a service. I know You know, I invest in myself. I use high quality products and high quality tools. So, you know, I invest in what I'm doing so that I can provide my clients with nothing but the best. You know, a lot of people don't realize something shouldn't be used on the bottom of their foot, or maybe the grit is too high for what they have going on and it's just shredding their skin.
Mhm.
So, but you being a regular person, you wouldn't know that. That's why it's good to go to someone who does have that advanced foot care or have the knowledge and, you know, take interest in that versus this just being a job.
Yeah.
So
And you do all your extra training because I always see you post about it on social media. So
thank you.
it makes us feel safe and secure with you.
Oh, thank you. Thank you. I think a lot of my clients feel that way.
They
They
do.
do.
It's nice being the one person in there and the fact that you don't rush a pedicure. Like if someone had to go somewhere else, what is a typical time do you think someone should spend on a pedicure? I ask this because sometimes you go to places and it's so rushed and it makes me think like, did they do everything?
Well, I mean, 45 minutes to an hour. That's
Hmm.
what I book mine out, 45 minutes to an hour. I take that extra hour so that way if I have that extra time, you could be sitting here drying, I can be getting my tools prepared or, you know, putting them away wherever it needs to go. Or, you know, people like to add on services. So let's just say you said, you know what, Lanessa, I want to upgrade to that foot mask. At least I know if it normally takes me 45 minutes to take care of you, I have that extra 15 minutes to be able to give you the extra thing that you want. But I would say 45 minutes to an hour. I normally always book out just my regular pedicures at an hour so that I can have time because here's the issue. You can schedule a regular pedicure, but then walk into a situation and I'm like, what is going on? Right? So I'm like, well, this is unexpected and I'm gonna take my time to fix it. I'm not gonna bypass it and being like, well, I'm not taking care of that, you know. So I'm gonna actually go and be like, take my time and make sure that I'm taking care of you the way that you need to be taken care of. Like I said, the foot health is my number one thing. So if anything else, I'm gonna make sure that your toenails is pretty and shiny before I even throw any polish on. So
Hmm. I
yeah.
love it. Thank you so much for joining me on here. We'll post your information underneath this. That way people can get in touch with you. And of course, I highly recommend her as I go there myself.
Thank you so much for having me.
You're welcome.